Hello and welcome back to our channel. I'm Dr. Halim Sethi and see who is there with me today.
Hi, I'm Dr. Pradeep Singh.
Today we will talk about a problem which is very common and very less spoken of, and that is gum bleeding.
You're right, Halim. Gum bleeding is one of the most alarming problems these days. And today we know how to prevent the gum bleeding and to treat the same problem. So let's start from the basics.
Yes. Have you ever noticed blood while you're spitting during brushing? That's a warning sign.
And sadly, Halim, these days this sign is being ignored by mainly the advertisements which show specific paste, medicine paste, which people apply and suppress that sign. But actually, the disease is not cured and it's still happening inside your body, causing more damage.
So that you mean to say that's a sign that something wrong is happening in the body.
Definitely. Our body is a very scientific model made by God. And bleeding is a sign which it's saying that something is not healthy with our gums. And we should better go to the doctor or the dentist and get checked as soon as possible.
Yes, your gums might be bleeding, but your body is screaming for help. Are you listening?
So let's try to understand what actually is causing this bleeding in the gums.
Well, Pradeep, we know there are multiple reasons of bleeding gums. Most common being gingivitis. Let's take one by one.
Yeah, you're right, Nalini. Gingivitis, in common term, is the inflammation of the gums. When we don't clean our teeth properly, there are deposits which can be hard and soft in between the gums and the teeth, which irritates our gums, and it causes bleeding from the gums because the gums are diseased. So this is gingivitis causing bleeding of the gums.
Exactly. And people think it's because of the faulty brushing or hard bristles they're having bleeding gums.
Right. Yes. The second most common reason for bleeding gums is hormonal changes in our body.
Being a woman, we know how our mood swings with the different levels of hormone in our body at different stages of our life, be it menopause, puberty, menarche, pregnancy. In those times, the blood level increases in the gums, which makes our gums irritable, and that's why bleeding happens. Isn't it, Prabji?
Exactly. Who knows better the mood swings can be? And I would like to stress upon one point at this level of our discussion, especially in the pregnant females. The patients who come who are expecting, they suffer from a condition called pregnancy gingivitis if the gum health is not taken care of. So I would like to request all of you, those who would be mothers, to please don't miss your dental appointment during the 3 trimesters and keep your gum absolutely healthy and germ free. This will really help you see through their pregnancy phase.
Simple tips like brushing twice daily and flossing will go a long way. Isn't it fascinating how fluctuations in hormone levels can create havoc in the gums? What about medicines?
Yes, Hari. There are some medicines which also affect the health of the gums. Rather, I would say they make the gums more susceptible to bleeding. Drugs like hypertensive drugs, psychotic drugs, and also drugs taken for epilepsy. These are the few drugs which cause increased susceptibility of gums to bleed if we are not taking proper care of the gums health. So it's an advice that people who are taking such drugs should take some additional care to keep the gums clean. Since we can't stop these important drugs, we can at least go to our dentist and take additional care of our gums so that there's no side effects of bleeding on the gums.
Correct, Prabdi. So now let's move on to the next cause of gum bleeding, deficiency of vitamins. Two most common vitamins which, if are insufficient, can cause gum bleeding, which are vitamin C and vitamin K. Vitamin C helps in collagen building, and if there is insufficient levels of vitamin C in the body, that can cause gum bleeding.
Right, Hari. And vitamin K also is an important vitamin because it controls bleeding in our body, and deficiency of the vitamin K causes increased susceptibility to bleeding gum.
Let's summarize once again.
So the bleeding of the gum is caused by many factors like improper gingival health, by certain drugs, by hormonal changes, by vitamin deficiencies.
Yes, Prabjeet. Now let's go on to the next problem which causes bleeding of gums. Apart from bleeding gums, what are the other symptoms which people should look for when they have unhealthy gums?
So, Vagni, in order to identify whether the gums are unhealthy, bleeding that we have discussed is one of the signs. Apart from that, there are many other things which you should look for, like loose gums, receding gums, gums which are leaving the teeth, that is receding gums, swelling in the gums, And to be severe conditions, the teeth might get little mobile. You can feel the teeth moving. These are the signs, other than the bleeding of the gums, which signify or indicate that your gums are not healthy.
Don't wait for the last moment. Doesn't it sound that gum inflammation can be a big problem? Let's talk about the treatments now.
You're right, Ali. Actually, gum disease is a silent killer in our body. Why? Because it does never pains the patient. The patient never feels any pain, and that is why it is most neglected. But let me tell you, it is one of the most serious problems. To quote some, a gum disease gum can cause a cerebral shock. A gum disease can cause, rather, they cause about 60% of premature deliveries, and there are more to come. So, how do we treat this gum problem? So, most importantly, we can classify the treatment into two categories. One is when there is no disease and the gums are healthy, and we prevent bleeding to happen. The second category is when the disease has already started in our body, and how do we treat that?
Let's start with preventive. Easiest way is brush twice daily with proper technique of brushing. Floss at least once a day. Rinse your mouth after having your meals. And what else? Mouthwash or non-alcoholic mouthwash if you want to go for it.
Exactly, Ali. Most people are very fascinated with mouthwash because they think their breath, the odor of the breath can, change with the mouthwash. That is not so. It is how well you maintain the health of the tongue. So the next category of treatment comes when the disease has already occurred. That is gingivitis or inflammation of the gum has already struck you, and you can see signs of bleeding. Immediately rush to your dentist and look for the treatment rather than suppressing it by looking to an ad of a medicated toothpaste and waiting for the words to happen. So, what does the dentist do? Now, the dentist do a very simple procedure to just remove those irritants which are there in between the gums and the teeth. And this is done by various cleaning procedures by using ultrasonic cleaners. And off late, the most advanced way is to use an aqua care. This simple cleaning procedure, which is, trust me, painless, will treat your gums, make them healthy, and take care of the bleeding. But this is not the treatment forever, because once the cleaning is done, it has to be clean again, because after that you're not going to stop using your teeth, are you? You'll keep using them, and so they will get dirty. And so make it a habit to go once a year at least, just once in 12 months. I think you can take out half an hour to go get a cleaning done by a professional and have a happy life.
Oh, now gum bleeding is not so scary for you. Now you know the causes, prevention, treatments, and जाते जाते एक बार mythbuster भी कर दे.
Yes, Salim, definitely. So there are a few myths which I would like to clear at this moment, like weakening of teeth happens once we get a cleaning done. Pregnancy में cleaning नहीं करनी चाहिए. So these two are myths. Trust me. After studying dentistry for more than 5 years, why would we give you an advice which will weaken it? It is our responsibility to make your teeth healthier and strong. And cleaning is one such procedure which does that. So next time, don't hesitate and get your teeth, gums clean and maintain a good oral hygiene.
If you have any other queries, ask us and visit us at Dontia Dental Care, Kolkata. जल्दी जल्दी like दबा दो और subscribe कर लो. Thank you for watching.